$4,000, and of course it's going to be much more in some states and much less in other states, but for every $4,000, there was a child not going to receive child care subsidy for an entire year. So it was very important that we look at the fact that, oh my goodness, if it's $500,000, that's a lot of children not going to receive child care subsidy. Even if the overall error rate is fairly low, every dollar counts. And I know all of you are concerned about that as well, so this is a great opportunity for you to hear from the experts regarding these issues, and I know it will be a great phone call. I'm going to turn this over now to Monica.
Good afternoon, everyone. This is Monica Huggins, and I'm the Director of Oversight and Accountability. It's a fairly new position in the Office of Child Care. I just want to echo Ellen and say we're, very glad to have so many of you join us for this important webinar this afternoon as we kick off and reinstitute our Program Integrity Conference Call series. I want to take a couple of minutes, first of all, to share with you an OIG report that was issued in July of 2016. Next slide. And that report was titled, "More Effort is Needed to Protect the Integrity of Child Care and Development Fund Block Grant Program," and it was conducted by the Office of Inspector General. The report provided the results of the OIG state study that focused on how states and ACF ensures the integrity of CCDF program and the results of the state's program integrity activities. So they, were out in the field looking at not only the states and what their activities were, but also what we were doing here in central office. The results of the program, state program integrity activities, which included anti-fraud fighting activities. This is a conference call series as part of our efforts, first of all, to support states in implementing program integrity activities, and Ellen eloquently stated how important that is. It's also our goal is to strengthen our communications with states to determine what your technical assistance needs are, and it also provides a forum to sharing best practices, because we know with you working on the ground with the families and administering the program that you know firsthand what those practices are. So we hope that as we roll out this conference call series that you will be able to share with us some of the best practices, and so that people don't feel like they're starting the wheel over and they can begin to learn from others. So right now I think we should get right into it because we only have about 55 minutes and we have a very full agenda. Next slide. Okay. So, there are several regulatory requirements that must be met in an effort to reduce errors in the CCDF program, and that includes minimizing fraud, waste, and abuse. Lead agencies must provide assurances that funds are being used for allowable program purposes and for eligible children and families. And so when you're thinking through that, I think it's important for lead agencies to have processes in place that promote program integrity and financial accountability, while at the same time balancing quality and access for our eligible families. A foundation for accountability should be policies and procedures that help low-income parents access child care assistance to support their work and while they attend training, and also, more importantly, to promote children's success in school. As the lead agencies establish new policies and procedures, steps should be taken to include a variety of checks to detect areas where there may be vulnerability to error or fraud areas, which improvements can be made in serving our families. Keeping our families in mind, the regulation at Section 98.68A states that such internal controls should be undertaken while maintaining continuity of services. In other words, lead agencies must ensure that internal controls designed to limit errors and improper payments do not result in undue administrative burdens for families that would interfere with continued stable subsidy received for eligible families. I think we've talked a little bit about program integrity, but what's the difference between program integrity and fraud? To really put it in simple terms, Program integrity is ensuring funds are maximized and used for allowable program purposes that will benefit eligible children and families. Fraud is not specifically defined in the federal law or regulations, and so states may define fraud slightly differently, but many states define fraud as intentional acts that result in obtaining, continuing, or increasing the child care assistance benefit for which a family is not eligible and involved false or misleading statements. So that's kind of setting the stage for where we want to really focus our efforts, our attention during this conference call for the next 50 minutes. So with that, I think there's a polling question that needs to take place, and so I'll turn it back over to Leanne.
Thanks, Monica. Yep, we do have a couple polls to help get us started and learn a little bit more about who's on the call with us today. And actually here in Rossville, I just want to let folks know that I also have Teresa Campese and Katie Watts with me. They'll be assisting with the call today. So Teresa, if you could go ahead and launch that first poll. We're at about 45%. Oh, okay. Thank you. So for the poll, I'm sorry, I didn't realize that it had been launched because I could not see it on my screen. So we would like to know, with the lead agency staff, are you with the eligibility or policy unit? Are you with program integrity, fraud, or maybe a QC unit? Or maybe you're with the licensing side of the house. You could also select whether you're a state administrator or other program office leadership, or maybe some stakeholders, other parties at the local level. Due to the constraints of GoToWebinar, we could only have 5 responses there. We love our federal staff as well as our TA partners, but for this particular poll, we're just interested in learning more about the roles in the lead agencies. Okay, so for today, this is Teresa Campese. For our poll results, we have about 31% lead agency staff eligibility or policy unit, 35% lead agency staff program integrity or fraud unit, 4% lead agency staff licensing unit, 18% state administrators or leadership, and 12% stakeholders. Great, thank you. So we see the majority are eligibility or program integrity staff. Now we're going to go ahead and launch the second poll. And for this one, we'd like you to select one response, what fits your program office best, and that's where do you focus most of your program integrity efforts? Is it on staff training, those internal front-end strategies, subsidy or sub-recipient monitoring of the agency's administrative programs, client fraud, provider fraud, or fraud involving multiple parties? Yeah, go ahead. Okay, so the poll results are 28% internal front-end strategies, 25% sub-recipient monitoring, 10% client fraud, 25% provider fraud, and 12% fraud involving multiple parties. All right, great. So the top 3 there, internal front-end strategies, sub-recipient monitoring, and provider fraud. So we'll be touching on all of those topics today. And now I think I'm turning it over to Min.
Yep, thank you, Leanne. Good afternoon or good morning, everyone. My name is Min Lei. I'm with the Office of Child Care Policy Division. And I'm going to kick this part of the presentation off by providing a brief overview of what's in the new final rule, hopefully to provide some valuable context to you as before turn it back over to Leanne and her team to discuss some of the activities and strategies that are at your disposal. So to begin, the final rule added a new section, 98.68, which we're going to talk about here. And the regulatory changes here, you should know, formalize the implementation process of the CCDF plan, which require lead agencies to report in these areas. And ACF has been working with state, territorial, and tribal lead agencies to strengthen program integrity and to ensure that funds are maximized to benefit eligible children and families. These requirements in this new section build on these efforts, such as those that Ellen spoke about earlier, and are designed to reduce errors in payment and minimize waste, fraud, and abuse, and to ensure that funds are being used for allowable program purposes and for eligible beneficiaries. So the first part of 90.68 says that lead agency internal controls, or requires lead agency internal controls to include processes to ensure sound fiscal management, processes to identify areas of risk, processes to train child care providers and staff of lead agency and other agencies engaged in the administration of CCF about program requirements and integrity, and regular evaluation of internal control. In the final rule, we also have a preamble discussion, which kind of goes into some of the justification behind these, and in that we describe some examples of internal controls. And so the examples can include practices that identify and prevent errors associated with recipient eligibility and provider payment, such as checks and balances to ensure accuracy and adherence to procedures, automated checks for red flags or warning signs, and established protocols and procedures to ensure consistency and accountability. Again, those are just some examples that we put out there. Next slide. So in addition, 98.61B1 of the final rule requires lead agencies to describe in their plan the processes that are in place to identify fraud and other program violations associated with recipient eligibility and provider payment. These processes may include, but are not limited to, record matching and database linkages, review of attendance and billing records, quality control or quality assurance reviews, and staff training on monitoring and audit procedures. The provision of 90.68B2 of the final rule requires lead agencies to establish internal controls to investigate and recover fraudulent payments and impose sanctions on clients or providers in response to misuse of program funds. Again, as Monica mentioned before, we do not have a federal definition of fraud, so that's something that's defined by the state. But lead agencies are required to describe their plan, the processes that are in place to identify fraud and other program violations. The lead agency's requirements mandated under this section build on pre-existing requirements and are meant to reduce errors in payment and minimize waste, fraud, and abuse to, again, ensure that funds are being used for allowable program purposes and for eligible beneficiaries. Next slide. So the provision at 98.68C requires lead agencies to describe in their plan the procedures that are in place for documenting and verifying that children meet eligibility criteria at the time of eligibility determination and redetermination. Lead agencies should, at a minimum, verify or maintain documentation of the child's age, family income, and require proof that parents are engaged in eligible activities. That's something that we describe in the preamble to the final rule. Lead agencies are responsible for ensuring that all children served in CCDF are eligible at the time of determination or redetermination. And with 98.68B2, because new eligibility requirements significantly protect a child's eligibility between redeterminations, this is language that we've included to assure lead agencies that any CCDF payment made during the eligibility period shall not be considered an error or improper payment as long as the family is eligible according to the new eligibility criteria. So that's a very brief overview and rundown of what's in the final rule. And I think a lot of what you're going to hear will kind of build upon that. So thank you, Leanne, and I'll pass it back to you.
Thanks, Min. Just a quick reminder before I get started on this next slide is for all the attendees to please use that question or chat box. If any questions have come up so far, please feel free to type those in there. And if you have any questions throughout the webinar, again, please feel free to use that question or chat box. So just to kind of piggyback off of the regs that Min was citing, at Section 98.68, lead agencies are required to describe in their plan the processes that are in place to identify fraud or other program violations. So Section 8.1.4A and B of the state plans, it asks to describe the activities the lead agency has in place to identify program violations and administrative error to ensure program integrity. So here's the data that we pulled out of the state plans, all 56 of them. And the first column, the darker blue, represents both unintentional and intentional program violations together. And then the lighter shade of blue is administrative errors. So if we want to take a closer look at the three top strategies reflected in this data, those are review of enrollment documents, attendance or billing records, conducting supervisory staff reviews or quality assurance reviews, and training staff on policy and or audits. I obviously was curious, and some of you may be as well, as to what states were citing under that other option. And for both program violations and administrative data, for the most part, those comments were related to the other activities already identified and just adding additional information to help clarify some of those activities, such as what systems are interfacing and sharing data. Some of the other things that were mentioned were random sample case reviews, fraud detection units, and hotlines for complaints. Moving to the next bar graph, in 8.1.2 of the state plan, describe how the state or territory ensures that all staff are informed and trained regarding changes made to its policies and procedures to reflect the new CCDF requirements. So here you can see the different strategies identified by the state and the number of times, of course, that each strategy was identified. So 42, issue policy change notices, 39, issue new policy manuals, and you can see the rest there. We'll just leave that up for a second. The 13 other, some of the things that were mentioned there were designating personnel to field phone calls and emails, and then providing TA to the local agencies. Another mention was the policy unit reviewing trends in policy questions to help identify additional training. Policy tip sheets, job aids, workflow diagrams, those were all mentioned as well in that other column. Our third diagram from the state plan extracts, Section 98.68B2 of the regs states that lead agencies are required to describe in their plan the processes that are in place to investigate and recover fraudulent payments. So Sections 8.1.5, A, B, and C of the state plans asks which activities the lead agency will use to investigate and collect improper payments due to program violations or administrative error. So again, this bar graph, the columns represent the unintentional program violations, intentional program violations or fraud, and administrative error. We can see, looking at this bar graph, that the most common activities are to recover through repayment plans, reduce payments in subsequent months, require recovery after a minimum dollar amount of improper payment, and coordinate with and refer to other state agencies. And our last bar graph on the state plans, Section 98.68, sorry, I'm starting to talk too fast, of the regulations states lead agencies are required to describe in their plan the processes that are in place to impose sanctions on clients or providers in response to fraud. So this graph shows what type of sanction the lead agency will place on clients and providers in response to fraud. So obviously they're the most common. 52 out of our 56 states and territories will disqualify the provider. 47 will disqualify the client, and so on. Again, just a little information about the other column there. For the most part, again, these responses provided additional clarification to one of the other sanction types already identified. But one state did mention requiring a provider to attend some mandatory training in order to continue to participate in the subsidy program. So that's a little bit of nationwide data from the Section 8 program integrity of the state plans. And now we're going to pause for questions. And I'm going to turn it over to Katie for a minute.
All right, so it looks like we only have had one question come in. And of course, you know, if you do have anything, now's the time to type it into that question box or chat box. But we have a question from Suzanne West, and that is, what is the average recovery dollar threshold for intentional and unintentional errors?
Shelley, yeah, this is Shelley Dilks at the Office of Child Care. That's not data that we typically collect. We can certainly file that away and see if we can get some information from some other participants might want to enter an answer into the chat box, and that would help Suzanne with her question there. But OCC does not typically gather that type of information. And we'll pause for just a minute to see if anybody does have additional comments or questions that you'd like at this point in the presentation. This is our one stopping spot that we've got for Q&A. We might be able to do a couple at the end, depending on our timing, but we knew we were going to have an opportunity in the middle.
Okay, here's another question. It's from Matt Judge. The question is, what do we mean by fraud in this context? Is it a strict legal definition, or are we using the term generally and synonymously with IPV?
That's a great question, Matt. This is Shelley Dilks again. States have flexibility to define fraud. In some instances, it is considered an IPV. In other instances, it is determined in a court of law by a judge. And it varies widely across the country. So that's a great question. Thank you. For our intents and purposes, we are using it broadly.
We've had several questions related to making the presentation available after the call, both via email and through the chat and question box. And Shelley, would you like to respond to that, or would you like me to?
No, you go ahead, Leah.
Okay. We do plan to share the link after the webinar. We are recording it today, so we can share both the slides and the webinar once we receive the official OCC approval.
Did we get any responses for Suzanne's questions about an average amount recovered?
No, we have not.
All right. Well, if anybody thinks of it in your state and want to help her with an answer, feel free to add that. But at this point, Leanne, I think we can go ahead and go on.
Just real quick, I think Suzanne is referring to a specific section of the state plans and where it asks what's the minimum dollar amount that needs to be met before the state will pursue collection recoupment. And Suzanne, that information is available in the state plans, and I can send that to you, collect that data together in a spreadsheet and send it out. Assuming that's what you're asking about. Not the specific dollar amount that's collected, but what's the minimum improper payment amount before collection will be pursued. That information is what we have collected.
Right, yes. Thanks for the clarification, Leanne.
Yes, and it sounds like that did answer Suzanne's question.
Great.
Okay, so now we're going to go into strategies to increase program integrity. Here's just a quick overview slide to get us kicked off on our next set here. So we're going to talk through administrative oversight and control, prevention policies and procedures related to both family eligibility and provider and payment policies, as well as fraud identification and prevention. So first we're going to take a look at administrative oversight and control. While lead agencies do have broad authority to administer the program through other government or non-government agencies, the CCDF lead agency must comply with requirements for monitoring and management of those subrecipients. For those county-administered states, the lead agency is not looking solely at expenditures, but also performance of that agency. Written agreements should have clear expectations of the work to be completed, and the lead agency should know how the performance of that work will be measured for the subrecipients and contractors. What management reports do you have in place to monitor caseload activity, eligibility determination outcomes, enrollment numbers, and fiscal administration? Supervisory case reviews or desk audits at the local level are an excellent way to ensure consistent application of program rules. A question to think about here, and we've heard this on some of our site visits, are the results of those supervisory reviews at the local level shared with the lead agency? And is that something that you want to look at? In addition to those local supervisory reviews, many lead agencies are conducting ongoing case reviews every month as oversight, mirroring our triennial error rate review process. Look at both the denied and discontinued cases for accuracy, as well as those that were determined eligible and ongoing. One of the roles of a lead agency is to ensure that all children served in CCDF are eligible for the program. That echoes when Ellen kicked us off. When eligibility workers are not implementing policies and procedures correctly due to complexity, lack of clarity, or insufficient training, this is going to lead to administrative errors. Easily understood and clearly communicated policies also make it easier for parents and providers to better understand program requirements, including those related to reporting changes in their circumstances. When making changes to policies, are you thinking about the impact to access, continuity of care for the child, and administrative efficiencies? Ongoing case reviews, in addition to the error rate review process, will help policy teams in assessing the impacts of policy and whether a few tweaks to procedures can be implemented to reduce errors. Can any verification or reporting policies be aligned with other programs to make things a little bit easier on the parents and the workers that are managing a caseload that consists of multiple programs? Thinking about those other programs, TANF, SNAP, Head Start, Early Head Start, can redeterminations be aligned to benefit both the families and the case managers? If there are multiple workers, are there clear communication channels in place for those workers and the family? Do the workers or systems share information about the parent that can prevent duplication of effort? Moving to verification resources, what other systems interface with your eligibility system? Lead agencies are responsible for ensuring that all children served in CCDF are eligible. Is there a way for you to obtain documentation that eliminates any possible errors or potential for fraud? We know that 42 out of 56 lead agencies are sharing data across programs or with other databases. Some examples of using databases as verification include your TANF and SNAP programs, child support enforcement, the work number, Social Security Administration, unemployment compensation, the IRS. The list really does go on and on. Using these automated verification resources can also help to reduce paperwork. Instead of a paper document being required in the file, the verification is automatically documented in your system, so no additional papers are needed in the family file. No errors related to missing documentation. And finally on this slide, system automation. In an effort to reduce or prevent errors, lead agencies are making changes to their IT systems. IT systems that automatically calculate the family's income, co-payments, generates alerts to the worker, has a disability or training coming to an end and notifies the worker, redeterminations coming due, and that's just to name a few different alerts. Eligibility systems may also generate some soft warnings during the eligibility process to prevent or reduce administrative error. Moving to provider and payment policies and procedures. Again, when thinking through need for care, enrollment authorizations, billing, and other policies and procedures, clear and consistent policies will reduce errors, increasing your program integrity. The first bullet is related to payment accuracy. Lead agencies determine how to provide payment for the child care received, including who processes that payment, the payment mechanism, is it an electronic transfer into the provider's bank account, transfer of funds to an EBT card, a check, and then the type of documentation required for the payment. Do the payments accurately reflect the child's age, type of care, any special needs, and other payment factors? To ensure payment accuracy, we know that 91% of states and territories are reviewing attendance or billing records. If you have a time and attendance system, how does the system support enrollment and program integrity, ensuring that the appropriate payments are going out the door? When thinking about authorization of hours and need for care, do the authorized or approved hours include travel time and other considerations beyond the parent's work or training schedule? The Act also requires lead agencies to delink reimbursement rates from the child's occasional absence due to holidays or unforeseen circumstances to the extent practicable. What adjustments are you making in your policy or the system to allow for delinking? And how are your staff trained on those changes? Lead agencies must also establish policies to ensure providers are operating legally. A common strategy here is a combination of both announced and unannounced inspections or visits. Some other policies and procedures are to establish communication protocols with the state licensing authority for monitoring changes in provider eligibility and violations, coordinating with a child welfare agency on child abuse and neglect complaints, and conducting investigations or site visits in responses to complaints about unregulated providers. Policies on out-of-state providers. If your state is not licensing or issuing a certificate to the provider, how are you ensuring compliance or that the provider is operating legally in their home state? What sort of additional forms or documentation does the provider need to complete for your subsidy program in order to receive payment? Do you know who the contacts are excuse me, in your neighboring states? Sorry about that, I just needed a drink. Communication between the licensing and subsidy staff really is critical in each of the agencies. When licensing takes action to suspend or revoke a license, how's the subsidy side of the house going to be notified? What if there's an emergency closure? How will those subsidy families be notified? And how about some R&R for all those families so they can locate some new providers? Now we're going to move to some fraud identification and prevention strategies. And Min touched on this too a little bit earlier. There is an expectation that lead agencies have strong processes in place to detect fraud and improper payments, but these need to be balanced with some family-friendly policies. So here we have a list of just a few strategies that states can use to identify and prevent fraud. But states and territories could definitely be utilizing some other strategies as well. System flags and reports, and this includes data mining that we're hearing a lot more about all the time. Some examples of data mining and system flags are providers that are over licensed capacity, providers that consistently report perfect attendance or are never closed, school-age children receiving full-time care during the school year, parents employed by providers where their children also attend. An example of a report would be one that shows worker overrides on eligibility determinations, or maybe when that worker does perform an override, an alert is generated to the supervisor. Processes to routinely check providers are operating legally. I touched on this on slide 20, but there is an overlap in strategies with increasing program integrity and strategies to identify or prevent fraud. Excuse me. And one of the big ones here is the combination of announced and unannounced inspections or visits. And again, the communication between licensing and subsidy, both from a system and from a system IT and a program office perspective, are critical. Parents also, they're in the provider location daily. Give them a way to report potential fraud by using a fraud tip hotline or an email inbox. Activities to identify and prevent administrative errors. Again, back to those system flags or reports. What do you see in your agency as a result of quality control measures? And can the system help to identify or prevent any of those administrative errors? Does your system have a built-in audit trail to track changes that are made in a case record? Quality control units perform random reviews, and that can also help to ensure workers are processing cases per your policy. If those quality control reviews show common errors or any fraud-prone areas, is training provided to the staff? Processes and procedures to identify potential improper payment risks before the payment is made. Linking those licensing and subsidy databases can be a way to check that providers are not receiving subsidies for more children than they're licensed to serve. And it may also flag providers who are at risk for fraud or abuse. Linking to other databases and records can also help in preventing improper payments. Creating a unique client identifier to cross-check individual information provided by parents and providers across state and national databases is another common strategy. Training of staff on simple front-end detection is also a common strategy to catch fraudulent or potentially fraudulent activities before payment goes out the door. So train your staff. What would have hampered pampered pay stub look like? What questions should the worker ask when a parent reports that their employer is the provider that their child is currently enrolled at? Train staff on those high risk factors that have been identified, and what training strategies are in place for your eligibility workers. Now that the suspected fraud or overpayment has been identified, does it rise to the level of an investigation? How will your agency make that referral for investigation? What's the process going to be? What individuals or agencies are involved? Relationships and communication are key with those other agencies or bureaus. In recoupment, while lead agencies are required to recover payments that are a result of fraud, lead agencies have discretion on how the payments will be recouped. Some examples of recouping funds include repayment plans, reduced payment in future months, and tax intercepts. All right, I feel like I covered a lot of information very quickly. So hopefully we still have some time for some more questions and responses.
Yeah, so we don't have any more questions that are in at the moment. Keep them coming if you do have anything. But another thing that we're going to ask is OCC and the Subsidy Center are always looking to share information across programs and with stakeholders. So thinking about your program integrity strategies, please use the question box to share a new strategy or one that has been especially effective. This is an opportunity to let us know what's been working in your state or territory. And if you would like us to follow up with you, please add a note and we'll do that. So we'll give you a few minutes to think about some strategies that are working well in your state or territory and enter them in the question box.
Yep, we'd love to hear from all of you about what's working in your state. So if you could please type in some different strategies and then we'll share them out with the whole group.
Okay, so we have a couple of responses come in. Dana from Hawaii, Dana Balancig, working on IT system modification to do income calculation and preventing payment if background checks are not current. Lori Jewett, initial training with home providers is a good preventative measure. Also something called the red flag report that we use.
Lori, do you have specific examples of what types of flags your report pulls?
Lori said yes, so maybe she's going to type in a couple examples.
Yep, we probably have about 2 or 3 more minutes, so if you have other strategies, want to share what's working in your state, examples of different red flag reports that you run, please go ahead and share those in the chat or question box.
Yes, so the red flag report mentioned by Lori, an example that she gave is it shows providers that are maxed out each month. Kathy Finnegan shared that prior to the start of the audit, we did several months of reviewing child care cases. Rosalva Orozco, stipulations used to get providers back into compliance, surveillance, unannounced site visits, centralized and shared referral databases for all state client referrals and overpayments. That's
quite a few good examples. Jenna, Broadway. Red flag reports include provider services outside of provider agreement hours. And then Reginald Williams shared that Florida is updating its statewide information system to automate eligibility determinations and provider reimbursements. Audit features will be included to enhance program integrity. These are all really good examples of strategies that have worked or new strategies. Leslie Henderson shared that we conduct ongoing child care reviews during off-cycle years, and that's great. I know quite a few states do that. That's a really good strategy. All right, one from Tammy Childress. We look at no absences paid, paid maximum authorizations, and multiple providers paid for one child. All right, thanks everyone for your comments there. We're going to go ahead and move to the next slide, and then hopefully we'll have a few minutes at the end to get to some more questions. So here we just want to share a few program integrity resources that are available for everyone. That CCDF AFC PI 2010 to 06. Sorry about that. That is from 2006 or 2010. I'm sorry. But it is still a good source of information related to program integrity and financial accountability. So if it's been a while since you looked at that, please go ahead and take a look at it again. The past program integrity conference calls from 2010 and 2012. Again, when this PowerPoint is shared out with everyone, you'll have the link there, but those are also available on OCC's website. And a couple things that we have in the works at the Subsidy Center. The first is a fraud toolkit. Our hope is to get this to be an online module with a couple different buckets or areas for states to focus in on. And it will start, hopefully, with an assessment, a quiz for the state or territory to take to see where it stands in relationship to program integrity. And then we'll take some deeper dives into detection, prevention, enforcement, monitoring. Try to just have, again, a toolkit out there that digs into each of the different buckets of fraud. We have also updated the grantee internal control self-assessment instrument, and that is in the works. It's with OCC right now, but hopefully we can get that out to the states and territories soon. And it's being reflected to show the changes with the new law and the regulations. So again, you can look for that coming out soon. So this slide is to get everyone prepped for the May phone call. The second call in the Program Integrity webinar series, we'd like to hear from at least one, hopefully two states or territories that would like to share a little bit more about the programs, what they're doing in their program. So two questions here for you to enter some information into the chat box. The first one is, what do you want to learn more about? Like I said, I feel like we talked real fast about a lot of information and didn't really dig a whole lot due to time constraints, but is there some topics that you want to dig deeper in the May conference call? Do you want to talk more about provider fraud? Do you want to hear more about data analytics and the reporting, red flag reports? Or if you have something really exciting going on in your state right now, is there something that you would like to share with everyone? Recently had a site visit just a couple weeks ago that started a new fraud unit, and they were very excited about their work. So maybe they would like to share with everyone. So again, if there's a topic that you'd like to learn more about in our May or June call, please go ahead and enter that into the chat box. Or if you'd like to send an email, you can certainly do that as well. The questions will also be on, these two questions will also be on the survey that will pop out as you close out of the webinar. So if you don't enter them in the chat box, you can also go ahead and enter while you're taking the survey. Did we get the link posted in the, nice. So the link is posted in the question or chat box. So if you haven't registered for those yet, you can go ahead and do that. And I think I will turn it back over to Shelley and Ellen.
This is great. Thank you, Leanne. This is Shelley back at OCC again. I want to thank everybody so much for attending the call today. We're very excited to be able to start these calls up again. Many of you will remember the series that we had back in 2010, 11, 12, and 12. There was a lot of sharing across the state at that time. And we really are looking forward to having you share with each other again. You all have updated your policies, your procedures, your IT systems. I'm looking forward to hearing about Florida, what you all are doing down there with your IT system. Reginald, thanks for sharing that. We will have an evaluation pop up at the end of the webinar today. With some broad questions. Please, please, please tell us what else you would like to hear about. We're going to continue the series. Right now we have calls set for May and June. We'd like to continue beyond that if possible. And we need to do that in partnership with you all. Again, I want to thank you for your attendance today. If you have additional questions that you'd like to enter in the chat box, we'll field them on our end if possible. Katie, have you gotten any that we can take for the end of the road?
We have some suggestions that have come in for future calls. We don't have any other questions that have come up.
All right. Well, we'll look at the suggestions offline. We'll give you all 3 minutes back in your day. And again, thank you so much for your attendance today. We really appreciate it and look forward to talking to you again in May.